Welcome back to the podcast, Lauren. Excited to have you.
Michelle, I'm so excited to be back with you as well. I really enjoyed the conversation we had in the past. Really excited about the conversation we had that showed up on the Conscious Fertility Podcast with you, and happy to talk low-level laser with you today.
Yes. So last time we got really deep on the conscious fertility and spirituality, and I love that quantum. And today we're going to talk a little more about laser therapy and how that can benefit fertility, egg quality. I'm very excited to hear more about this.
Same. How do you want to start? Because you and I could go for hours on
Yes, we
this.
can. That's for sure. So, for people who have never really heard of laser therapy, low level laser therapy, right? That's really LLLT.
Yeah,
Is
triple L, low level. It's got a couple of names. So in
Mhm,
the old days, they called it cold laser because it's the non-heating laser, the class 3B that you and I are going to talk about.
mhm,
Um, then it became known as low level laser therapy because they wanted to differentiate between the high powered ones. Like there are lasers that can cut and burn and sculpt
mhm.
you.
Right.
People know about sculpting, hair removal, surgeons about cutting. That's not what we're talking about. So it had the term low level laser therapy, which is what I think the public knows. So we usually use that term a lot.
Mhm,
But in the scientific community, they adopted the term photobiomodulation,
mhm,
photons, light, bio, the body, modulation, can it make change to the body?
mhm,
And that's because systems have both laser diodes and LEDs as their way to put photons into the body. So
mhm,
low level laser therapy is inaccurate because some of the systems are using LEDs.
mhm.
So but we use them interchangeably, photobiomodulation and LLLT, low level laser therapy. If people are Googling it, that's what you would put in.
Yeah, because I think that's like the common term for it, where people are gonna search it for it. Now, I remember watching a video like years ago. I think it was during the pandemic, talking about like really the sun and cellular melatonin, and then talking about really because that's kind of what the idea is, or part of it is really getting that cellular melatonin and that light to induce better quality for eggs and cells. So for people who are first heard about this and don't know anything about it, can we break it down like in layman terms so that people can really understand what it is?
Yeah. So I'll share with you kind of from from our audience perspective, kind of what they really want to know, because I get these questions a lot. So I'll share that. And I think it's important to share kind of just how it kind of started with fertility. In general, with low level laser therapy, there's this mechanism that I think we can talk about with fertility. And you're mentioning like mitochondrial health, right? So
Hmm.
um, people in fertility understand mitochondria is really important. That egg cell, when it becomes the embryo, when it's inseminated by the or fertilized by the sperm, that embryo mitochondrial health is dependent or determines if it has enough energy to divide, whether it's in the fallopian tube or if it's in the IVF lab trying to grow out to blastocyst. So
Hmm.
that comes from the egg that becomes the embryo. It's the egg's mitochondria. And then that energy for implantation also requires a lot of energy. And that comes from the mitochondria. And the mitochondria are the battery of the cells. They create the cellular currency, ATP. That's where I think it all started. People got excited about it because of when we think of women and once they get into what they term advanced maternal age, and we have less fertility or increase in miscarriages or increase in birth defects, the current scientific understanding is because these eggs are older, they have more mitochondrial dysfunction,
Hmm.
and therefore there's more genetic errors.
Hmm.
And so the idea is maybe the light can rejuvenate these eggs. So that's kind of, I think, the thought process. But that was way back when. I kind of want to share what we know it's doing, and then share some of the mechanisms we understand, which is why people like yourself and me got really interested in low level laser for fertility because the mechanism is very promising.
Hmm.
Um, so it kind of, so many discoveries happen by mistake, and that's when
Happy
it came to
accidents.
photobiomodulation for fertility. Um, Dr. Oshiro is a medical doctor, pain specialist in Japan, and this was in the 90s. He was treating a woman with back pain, and he had this approach that he would, and she, by the way, was not menstruating anymore. She was in that early part of her life of menopause. Um, he he would always treat around the neck and a few other areas to increase blood flow. So he had this approach where he wants to increase blood flow head to toe, because if there's an injury in your back or your knee or your big toe, if we can bring blood flow to that area, that will support the healing. So he did that treatment where he created blood flow head to toe. And in his research, he actually has a really interesting diagram using thermal photography to show the increase in blood flow head to toe before a session of laser therapy, and then after the first, and then after the fifth. And it was just quite dramatic, the change. So he treated her for several treatments. He also would go locally. So if you had knee pain, he would treat with the laser over the knee pain. He'd use, in her case, she had back pain, so he did low-level laser therapy over her back as well. And she had a series of treatments, and her back pain was resolved, but her cycle came back, and she didn't want to have her cycle back, so she was concerned about it and unhappy about it and complained to him, is the story I heard. And he was like, look, I don't think it has anything to do with what I've done. Go speak to your gynecologist because you're bleeding again, and just to make sure everything's okay. In that same calendar year, another woman with back pain who wasn't menstruating was treated. So again, he did the treatment to increase blood flow. So those points, you'll see in my clinic, we do a lot of points around the neck. So we're getting the carotid, the vagus nerve, a feature called the statellite ganglia. And he treated her back and did several treatments, and her back pain was resolved, and her cycle came back, and she would bleed for a couple of days almost every 3 to 5 weeks. So then he thought, if we're bringing blood flow, if this treatment causes blood flow head to toe, maybe we're bringing blood to the ovaries and we're helping rejuvenate these ovaries, and that's why these women start to cycle again. So he went and talked to a colleague, gynecologists, and in their gynecology department to do a pilot study. And in that pilot study, there was around 74 women. The English translation is severe infertility. Mm-hmm. I think the average age was 39. I think they had on close to 9 years of infertility and 15 ART cycles. And they showed an over 20% pregnancy rate and over 60% live birth rate, which was quite good for that demographic. So they increased that study to 700 women, and their pregnancy rate was around 23%, and the live birth rate was 50%. So that's kind of how it started.
I remember seeing that study. Was that the one where they had a 50-year-old?
I don't remember. I'd have to look.
I actually didn't even pick up on that. Believe it or not, I didn't pick up on that. One of my patients did. Was a nurse, and I sent it to her because I sent her, and she was like, the 50-year-old. I'm like, the 50-year-old, and then I went back and I'm like, oh my god, yes, there was a 50-year-old.
Yeah, and I'd have to relook at the data. I don't, because these are people natural or IVF. Maybe I don't think in Japan they don't do donor eggs, so it wouldn't have been a donor egg cycle. That's why Japan's so interesting to see what they do, because they don't, back in the day anyhow, they weren't doing donor egg cycles. So they will bring in and try anything to help a woman conceive with her own eggs, because they don't have the opportunity in Japan to use donor eggs if it's warranted.
Right.
So that's kind of how it started. And then I mean, here we are now recording this in 2025, right? This is the 90s is when they had this study. I learned about this in the mid 2000s. So, almost over 10 years after they had done that first study. And I came across, there was a study in 2008, an abstract that was published where they did laser acupuncture, a little different than low level laser therapy, because they were just putting photons into acupuncture points. And in that case, they had a sham laser and a real laser and a control group, acupuncture group. And the laser acupuncture group, and this was just immediately before and after transfer, they were fresh day 3. So it was a while ago, right? Because now most cycles are blastocysts, transfers, most, not all. And most are quite often frozen, not fresh. But this was a day 3 study fresh transfers. So they did that acupuncture study known as the Paulus protocol before and after, but they used the laser acupuncture sham. Sham means the laser didn't work. It still beeped, but it didn't actually give off any photons. So the doctor nor the patient nor the acupuncturist knew they were getting laser or not laser. And in that group, the laser acupuncture had a 15% increase in implantation.
Wow.
And that's just on transfer day. Because remember, all you're doing is helping with uterine receptivity with one treatment, right? On transfer day. What Oshiro was doing was more about egg and embryo quality, because he was treating them for a series of treatments in that case. And then I learned about Anne-Marie Jensen, who's a physiotherapist trained in low-level laser therapy. And she just did some chart reviews, and she shared some pretty impressive success rates with people using her system called the Giga laser that she has. We have one in Vancouver as well, a Giga laser. And she would treat them 3 times a week in the follicular only. So before up to ovulation, or if they're in an IVF, up until transfer day. And so that worked out. If it's, if you're menstruating fairly regular, that'd be 6 treatments a cycle. And she would do on average at least 3 to 6 cycles.
And how long is each exposure?
The exposure for the Giga laser, it's program 6, is 23 minutes. So they'd have 23 minutes. And she's written a book. Since then, she's done another chart review from her data in 2021, because in that the one where she showed really optimistic success rates with her Giga laser, and we'll talk about the mechanism why I think the Giga did so well in her case. But she does a lot of body work, like stretching yoga and breaking up scar tissue. So they would have the laser on, the Giga hovers over while she was working on their abdomen, right? But she had a group in 2021 of 60 women where they had no practitioner, no treatment. They would just come in and do self-serve with the Giga laser. We do this in Acubalance now too. They can just book the Giga. They have to have an initial consult for safety and make sure we can set up a plan for them. And it's a good choice for them. So she does that in her clinic, and they would come in on average 2 to 3 times a week. And she looked at their success rate based on age. And again, really good results using her system, the Giga laser. And for those that, you don't need the Giga laser. It's nice because if you want to repeat what somebody else is doing, that's why I like having the Gigas, because Anne-Marie had so many cases that she could share with us. But, if you look at the Giga has like 36 laser diodes plus 144 LED diodes, right? So it's a lot of lights that they have. So it covers a large area. But if you play with the math, a practitioner can try to replicate that with their system. It may require more time or other things, but you can do your best to replicate. Here's now where we get into the mechanism. And there's been more studies. I'll give one more research, and then I want to kind of talk about the mechanism and why I think it's of interest. And hopefully more research will come down the pipeline on using low-level laser therapy. So there was a study done in mice that I thought was really interesting, where they lasered just one ovary. So they literally did an incision, pulled out the ovary, lasered it, put the ovary back in, stitched up the mouse, and put it through an IVF cycle. And the mice that had their ovaries lasered, that ovary, so if it was the left only versus the right, that had better, they had a better response to the IVF. And they made better embryos.
Wow.
So that was a pretty interesting study. Now the mechanism, like why are we interested in what can be happening? Because we have a sense that it can help. Anne-Marie's done a lot of case reporting. There have been studies now using lasers for advanced maternal age and PCOS, endometriosis. Again, I'm talking low-level laser therapy. I want to keep repeating that, Michelle, because somebody who's a physician may be thinking their laser and going, what?
Yeah.
So
no, it's
we're
good.
talking class 3Bs, low-level laser therapy. So PCOS, endometriosis, sperm. So studies on sperm as well. There's studies using it where people have had recurrent implantation failure. So they've done multiple IVF cycles with genetically screened embryos, and then they do the laser and they see an improvement in that implantation, receptivity. There have been studies just looking at the uterus in petri dish and doing different doses of laser, showing enzymes and gene expression for receptivity, right?
Wow.
So, we're starting to understand the mechanism. So we're seeing that it can help in some cases. And here's why I got interested in it. So obviously, like you, when I learn of something that can help our patients, I get very interested. They're so motivated. They invest so much time, money, and emotions into this journey. When I heard about the 2008 abstract, I called the IVF clinic. I talked to one of the IVF doctors involved in that clinic, in that study. I talked to the acupuncturist, and we started using that laser. We actually bought that laser and started just doing transfer day treatments.
And this is the Giga laser?
This was the Luminix laser back in
Luminix.
2008, because that's what was used in the transfer day study. That company is out of business now.
Okay.
I still have the Luminix lasers, but when they have issues, I don't have anybody to repair them yet.
Right.
I have a lot of laser systems in my clinic over the years, but that was kind of the first system I bought because I wanted to replicate what they're doing in the IVF setting. And so that's, a system we used to just use on transfer day. Then I heard about Oshiro and I started learning more. There was The Brain's Way of Healing by Norman Doidge. Chapter 4 was on using a laser for people with brain injuries. But he started sharing a couple cases of women that had endometriosis and adenomyosis. And Fred Kahn is a vascular surgeon who went into laser therapy, and he's passed now, but I got to meet him several years ago. And he had noticed that when he was treating these women, that their pain and inflammation would go away, and a lot of them wouldn't need surgery because of this.
Wow, that's incredible.
And just another tangent, when I was visiting Australia, I went to Roberta Chow's clinic. She's known for her publication in the Lancet, really respected medical journal for using low-level laser therapy for neck pain, showing positive results. And she's a medical doctor, trained in acupuncture, trained in low-level laser therapy. And when I was at her clinic, they shared that they do see a large number of women diagnosed with endometriosis, and a lot of them had symptom relief and had gone on to conceive naturally with the diagnosis of endometriosis.
And also Hashimoto's.
Yeah, it's been used, great point. There is some studies using it on the thyroid, because we used to think not to do it over the thyroid, but now for Hashimoto's and thyroiditis, they have shown that it can help with that as well. And so going back to like that research and studying what and why we like this mechanism, is the laser understanding is the mitochondrial function. So we've heard about that. But when Oshiro thought it was blood flow, that he thought, oh, maybe it's because we're increasing blood flow that we're seeing ovarian rejuvenation. So maybe this is why it's helping. I was thinking, I wonder if there's something else, because, hey, we do acupuncture, and acupuncture is really good for blood flow as well, right? So we got that covered.
Yeah.
What else could it be doing? And there was the mitochondria. So they show that low-level laser therapy, when the photons can reach the cell that we want it to reach, it will absorb those photons, and it will improve mitochondrial function and ATP. And we mentioned how that's important for early embryo development in the fallopian tube or in the IVF lab, and for implantation. Then we've learned later, because I was trying to think, why did the Giga have such good success rates, that Giga laser system? And because they did it just over the lower abdomen. That's how they did it. And I was thinking, okay, theirs was a much more powerful laser than Oshiro. Oshiro was using a system that has, I think, maybe had 1 to 3 diodes, but the total.
And he did this on the lower back, right?
He did it on the lower back for back pain, but his real treatment was around the neck and a point halfway between the navel and the xiphoid, RN12, celiac plexus.
Yeah.
And he did that because it increases parasympathetic response. Okay. So increases blood flow. So the Giga laser people, and again, I really do like the laser for the following reasons. So I was trying to understand, I wonder why the Giga lasers got such good results. And I was like, okay, it's giving off a lot more photons than what Oshiro was. So we're getting more photons into the body. the size of it is 500 centimeters squared. It covers a large area. So it's not
Mm-hmm.
only over the uterus, the ovaries, and the fallopian tube, it's over the intestines.
Mm-hmm.
You're probably getting a bit of the spleen, the liver as
Right,
well,
which
the
is all
organs, right?
helping with
It,
endometriosis and kind of,
you're getting a lot of
inflammation.
photons into the
Yeah.
lower abdomen, into the
Yeah.
pelvis, right?
Mm-hmm.
And a lot more photons because there's so much more power and you're doing it for 23 minutes. And so I thought maybe that's why theirs has helped. Since then, here's what I've learned, because that was back in over 10 years ago, right? We're 15 years ago probably, that I learned about it. Like somewhere around, where are we, 2025? Somewhere around 20. I've been using it since 2008, but somewhere around probably 2013-ish, I really got into, or 2012, into photobiomodulation. And since
Ahead
then,
of
we've
your
learned,
time.
it's been a while. Since then, we've learned that it impacts the mitochondria.
Mm-hmm.
Sorry, it impacts the microbiome. So the Giga is over the abdomen, and I was thinking the microbiome. Well, we know how much the microbiome is involved in hormonal regulation and in inflammation. Now, reproductive medicine has linked implantation
Right.
to the uterine
Uterine.
microbiome, and
Yeah.
so you got a mouth microbiome, gut microbiome, and all that stuff is influencing everything, right?
Mm-hmm.
And so I was like, oh, the Giga must be helping because it's also dealing with the microbiome. And the microbiome impacts skin health, because think of the inflammation, right? Impacts mood. I mean,
Mm-hmm.
it impacts our hormones, right?
Yeah.
So I thought, oh, that's probably a big part of it. And then we've learned that it also helps regulate blood sugars.
Mm-hmm.
And think of metabolic disorders like PCOS that have severe blood sugar issues and metabolic disorders. They don't ovulate as well. They may have a lot of eggs, but often there's poor quality because of the environment, right, that these
Mm-hmm.
follicles mature in. And so the laser's helping with blood sugar regulation. So there's all these mechanisms that it can do, and which is why I like the laser. And the way I like to share or describe it to my patients is I like to use this metaphor from nourish the soil before you plant the seed. It's a Chinese
Mm-hmm.
saying. And when it comes to fertility, nourish the soil before you plant the seed. And the story goes, if you had a plant and you neglected it and it looked a little withered and dry, rather than composting it, if you just add more water, maybe pull some weeds, add a little fertilizer, make sure it's getting sunlight, this plant often can regain its vigor and
Mm-hmm.
give off fruits and flowers. You've done this, right? I know I've done this. You've done this, right? For a plant.
Mm-hmm.
So the plant always had the potential to give off fruits and flowers, but the soil was suboptimal. So the plant couldn't reach that potential. We didn't do donor roots. It's the same roots, same plant, but the soil was suboptimal. So by adding water, pulling weeds, adding nutrients like fertilizer, make sunlight, the plant was able
Change the
to reach its
environment.
potential.
Yeah.
So in this metaphor, the plant is the egg cell or the sperm cell, right? And the soil is your cellular environment. And so let's look at the laser now from a plant metaphor and think about it from the body's perspective. So when the plant absorbs sunlight, it creates photosynthesis and creates energy.
Mm-hmm.
Well, same thing. When our cells absorb light, the mitochondria improves mitochondrial function and
Mm-hmm.
improves cellular energy. We need this. When the mitochondria get old and worn out, we get old and worn out and we die. Same thing with the egg cell, right?
Mm-hmm.
So it's really important. So there's the mitochondria part. Blood flow. Well, we know as a woman ages, her blood flow to the reproductive system decreases. And if we can increase blood flow to the reproductive system, this is a good thing,
Mm-hmm.
right? And so we know that low-level laser therapy can increase blood flow. This is watering the plant, making sure there's enough moisture so water can get to those roots. So low-level laser therapy increases blood flow and circulation. If you have nutritional deficiencies, right? So we said we add fertilizer. So, in our practice, that would be dietary therapy.
Mm-hmm.
That could be supplements, Chinese herbs. But guess what? There's research showing that when you use low-level laser therapy, the cells absorb the nutrients better. There's one done
Mm-hmm.
with mice on CoQ10.
Wow.
And, a lot of our
Fascinating.
patients
Yeah.
take CoQ10.
Yeah.
So all these supplements that you're taking you may even get more benefit from them, because if the cell is functioning better, it's going to have a better efficiency at absorbing. Think of your body metabolism. You can
Right.
eat a good diet, but if you have poor digestion, you
Correct.
may not absorb all those nutrients.
Yeah.
And you are just made up of trillions of cells. So if you are having all these health issues, then these cells are
All
likely
these
having.
supplements that people are taking, all the money they're
Yeah.
spending. Yeah.
Yeah. So the laser will help with that. Let's go into inflammation. So inflammation, and there's a term I play with, a medical term called inflammaging. And what that is chronic systemic inflammation. So inflammaging. And when it comes to fertility, we want to be as biologically young as possible. And with inflammaging, what we have is accelerated biological aging due to systemic inflammation. And this leads to premature degenerative diseases. And I say premature fertility issues as well. There is now literature out there and talk about how this chronic systemic inflammation is one of the culprits behind unexplained infertility and miscarriages. We already know it in PCOS, so that is known, and in endometriosis. It's so obvious the inflammation's there, but that subtle inflammation is not always as obvious, and that's what we call inflammaging. So low-level laser therapy has been shown to help with chronic, help regulate inflammation. And I say regulate inflammation because often we say it reduces. It's more of a regulator. And I'll say this for this reason. You know, when around implantation, ovulation, we don't want people to take anti-inflammatories because we need a little bit of inflammation.
Yeah.
Like we do need inflammation in our body for healing.
Mm-hmm.
You don't want to shut it down. And that's why you don't take it around ovulation or implantation, because that could interfere with implantation. Little tangent to tie into why laser is okay, because it regulates inflammation. We know this. That's why it's used so much in pain and injuries, because it regulates inflammation. So there goes the pain and swelling, and accelerates healing.
The difference is lowering inflammation versus regulating inflammation.
Yeah, and the difference is as follows. And there's a great back study to illustrate this. It's downregulating the bad inflammatory cytokines, and it's upregulating the good ones. Right? And so it's not shutting it down. When you take an anti-inflammatory, it shuts everything down. The laser is regulating. So some are being reduced, the ones that aren't going to help us, that cause a lot of pain and swelling. And then some are going to actually help with the healing. That's why inflammation, when you have an injury, and is a normal response that the body should have. We need it for healing. We need it for ovulation, implantation. So the back study, if I may, for a little tangent, they looked at a study, and people that have acute back pain, often when they get on these pain meds, so these anti-inflammatories, these strong pain meds, they end up with chronic back pain, because although they've shut down the pain, the inflammation, it's no pain, they also shut down the healing response. And therefore, later on, you end up with chronic back pain because the back didn't get to heal. When they did the study, and it was in the NIH that had recommended that acupuncture, massage, yoga, low-level laser therapy were suggested to be used before you use pharmaceuticals or NSAIDs, because of that reason, because the low-level laser therapy will regulate. So the difference is, when I see people for pain and they come in, we will help reduce the pain with the low-level laser therapy, because it's bringing down those inflammatory markers that create the pain and the swelling. But it's not shutting down those inflammatory pathways that are going to help with healing. Plus the mitochondria that have been damaged in the injury get rejuvenated, so it accelerates healing and reduces pain. If you use an NSAID, you're just reducing all inflammation, so no pain, but also you're slowing down the healing process, and now you're at risk of chronic pain later on. Tying this into fertility, because some people are concerned, oh my God, if it regulates inflammation, maybe I shouldn't do it. It's not like an NSAID. It's not turning off inflammation. It's regulating. Okay, it's a regulating process. And so we're, based on that thinking, not as much concerned. Stress can, so things that can affect inflammation, since we're talking about inflammation, a bad diet can affect inflammation. Your gut microbiome can lead to inflammation. So we talked about how the laser can help with the gut microbiome. It can't help with your diet. You have to choose a good diet.
You have to do that by yourself.
We know that it helps regulate inflammation in the body. So just general inflammation. Also stress. stress can cause inflammation. So chronic stress, worry, you start to release, more cortisol, all the adrenal hormones, and that leads to chronic systemic inflammation too if you're constantly stressed.
Stress impacts your gut microbiome too.
Gut stress impacts everything,
Yeah.
right? Because
Yeah.
the body,
Sleep. Yeah.
yeah, when your body doesn't feel safe, when it's in alarm, your resources are diverted from digestion and reproduction and to go into survival mode so you could fight or flight.
Mm-hmm.
And so Oshiro, when he did his treatment, the Japanese medical doctor, pain specialist, his treatment to help with blood flow was to activate the parasympathetic. So he was doing treatment around the carotid. He talked about
Mm-hmm.
that. So happens that if he's treating
Vagus
around the
nerve.
carotid, he's also getting the vagus nerve.
Yeah.
The stellate ganglia, our stomach 11 in acupuncture. If you get the right dose in there, at least 15 joules, we try to aim in our clinic for about 25 joules.
Mm-hmm.
It can create that parasympathetic response.
Mm-hmm.
Just so you know, there's research when they use, so the Western medicine knows this, they do a stellate ganglia injection when people have like thoracic outlet syndrome and all these issues to kind of get rid of the pain, right? Well, when you stick a needle in there, you need an ultrasound, and it's risky. It's a risky procedure.
Yeah.
It's risky. But Oshiro showed with low-level laser therapy, if you put in, again, I'll say I like 25 joules. I think looking at research, I'm going by memory here, it had to be at least 15 joules, at least, that you get into that area to have the effect. But there was a study that came out recently on using the injection, for post-traumatic stress disorder and anxiety. It came out and they talked about their sleep and their mood. And well, not surprising. Why is that impacting PTSD? Why does it impact sleep and anxiety? You're engaging the parasympathetic, the rest and digest, also known as the breathe and feed. Mm-hmm. And then that's the point he did over the abdomen, which so happens the Giga is over REN 12.
Right.
There's been research when you use low-level laser therapy over there. If you want to search it, LLLT over the celiac plexus. I think he called it the alpha sweep. Mm-hmm. He had this process he did, the doctor out of Germany, and it showed a parasympathetic response. So the low-level laser therapy can have that autonomic nervous system reduction, right? Like I want to say it differently, that overstimulated nervous system, that sympathetic high drive where you're not sleeping, you get headaches, your neck and shoulders are sore, you're getting hands and feet are cold, poor guts, easily irritable, poor gut, like digestion, all that could be signs of sympathetic overdrive, right? And remember, when you're in sympathetic, don't feel safe, the blood flow is diverted from reproduction, digestion to go to your major muscles, right? Your heart starts pumping. When you are in parasympathetic, the rest and digest, breathe and feed, emphasis on breathe for our audience, blood flow and resources return to digestion and reproduction. And so there goes more blood flow to the reproductive system. And when your autonomic nervous system is happy, when you're more in parasympathetic than sympathetic, we need both. It's a yin-yang balance. We're just way too much in sympathetic. Thank you to social media and all the crazy politicians of our world. Yes. We're really, in sympathetic a lot. And when we're there, reproduction gets down-regulated, right? And we're in this stress response. So it's not surprising that you see more health issues. And there's a study in the West called psychoneural immunology, PNI. Some now have named it PNEI, psychoneuroendocrine immunology. And basically, it's the research around your thoughts and your feelings. And we have data to show you that they impact your nervous system, your endocrine system, your hormonal system, your immune system. Well, the nervous system, hormonal system, immune system, hello, fertility. That's that's going to affect the whole hypothalamus, pituitary, ovarian axis for regular ovulation and the balance of hormones, the progesterone, estrogen. And we start having all these stress hormones and inflammation and poor blood flow. There goes your microbiome. There goes you optimizing your fertility, right? You're down regulating. So this is why I think acupuncture, and I also, if low-level laser therapy is used in a certain way, you can really support the nervous system, the autonomic nervous system, which will then help you get into that parasympathetic response. And so when you start to think, and it also, one more, The low laser therapy is shown to help with oxidative stress. Remember we said pulling out weeds from the garden? So oxidative stress is not great for sperm. It's not great for egg quality. And as we age, especially into our mid-30s and beyond, it seems like the cells in the egg cells, for sure, they've noticed, don't have as much resilience to deal with the oxidative stress. And so they get more damaged again. So that's why a nice antioxidant diet is good, and rest and stress reduction, because all those things, poor diet and stress, can impact oxidative stress in your body. It's just a byproduct of being alive. Think of it as when you're cutting your lawn, the byproduct is all that dirty grass on your lawn, right? So that's the oxidative stress. But if you put a bag over the lawnmower, you don't make a mess, right? So you want to do things to deal with the free radicals. People call it body rust as well, oxidative stress or free radical damage. Bottom line is oxidative stress, too much of it is really harmful to your cells, and particularly the sperm cell and the egg cell. And photobiomodulation, low-level laser therapy, has been shown to also lower oxidative stress. So when you think about how it has the potential, and I say potential because it's got to get to that cell, and just putting light on somebody doesn't mean it's going to work. Like, you can stand in front of your Christmas tree. Those are LEDs, red lights and yellows, but I don't think it's going to have a therapeutic effect. So there's certain wavelengths that are more beneficial than others. And then there's power that's important, and irradiance, which is another form of how many joules you're getting into this little area, joules per centimeter squared, for example, and total joules. So many people are just putting light systems on them. A lot of them are on Amazon, and I don't know, they haven't been studied, so I don't know if they can or cannot help, but to be therapeutic, the light does have to get received by the cell.
Right,
and there's a lot of
and it needs
factors
to
that can
penetrate the
impact
skin
that.
to go deep.
And the potential benefits then can improve mitochondrial function, can improve blood flow and circulation, can support your cell's ability to absorb nutrients from diet and supplements, can help with the gut microbiome, can lower oxidative stress, can regulate inflammation, and calm the nervous system. That, to me, is why I'm so interested in low-level laser therapy. And in our clinic, we're usually putting it around the neck. It's over the abdomen, so it's over the ovaries, the uterus, and the gut microbiome, where you're doing stuff on the sacrum. So we kind of took what they were doing with the Giga at Anne Marie's clinic, and then what we saw them doing with the Japanese group, Oshiro's group, how they did around the neck. We call it the modified Oshiro technique. And then when I talked to Roberta Chow in Australia and Fred Kahn, they were doing a lot of sacrum work for those that had endometriosis. Put this all together, pre-COVID. I'm actually going to visit them in a couple of weeks. So I'm going to Japan.
Oh, wow.
So
lucky you. I want to go to Japan.
We'll see what more information I have for
Amazing.
you. But I interviewed Dr. Nakamura and Taiken Joe, who speaks both Japanese and English, who's an acupuncturist, was my translator. Funny story. I'll tell you the funny story is I wanted to meet Oshiro. And so I went and created a letter and used Google Translate to put it to English to Japanese. And I sent it to all the clinics I could find in Japan that might be doing fertility and had an Oshiro on their websites. And I sent it. Nobody responded, but I did find Taiken, who lives in Japan, but was at the time lived in California, speaks both languages beautifully. And we connected, and he became my translator. He did read my letter and laughingly said, there's a hierarchy of respect when you talk to somebody in Japanese. So he said he's not surprised nobody responded to my letter. Google Translate did not do a good job.
Oh, that's so funny.
but anyways, he introduced me to Nakamura. He was interesting because this is pre-COVID. So we're in 2025 now, mid-2025. And this was before 2020. I interviewed him, and he'd already had 10 years of data. And when he shared what he was doing, so his 10 years of data, by the way, punchline, is it doubled blastocyst rates. So women that have went through IVF cycle and went to blastocysts, but obviously weren't getting pregnant because they keep coming back. if they did a series of laser treatments, a minimum of 3 to 6 months with his approach, they would have doubled the blastocysts they got. So even though they were 3 to 6 months older, they had doubled their blastocysts. How many embryos grew out to the blastocyst stage, which takes anywhere between 5 to 7 days to grow out, right? He's an acupuncturist in a clinic for IVF using acupuncture low-level laser therapy. So he was using the standard Victorian electrical acupuncture protocol for blood flow. So he did that. And then he did laser therapy. So I asked, what do you do? Because remember, everybody I was meeting, some were doing the sacrum, some were just doing the abdomen, some were just doing up here. And in our clinic, we started doing it all, neck, abdomen, back. And he said, oh, well, we do the electrical acupuncture, which we do a lot of that in our clinic with people who are going through IVF. And then he says, I will do kind of the Oshiro style. Then I would laser over the ovaries. And then he went and did over the pudendal nerve in the sacrum. Pretty similar, right? And so I came up with my protocol from talking to everybody. And it felt great when I met him because he'd been doing it already for 10 years. I've been doing it for, not very long at that time. And he had data to show that increased blastocyst rates. Amazing. So that's kind of my story of low-level laser therapy. And in our practice, we have many systems. We only have one Giga. And from Anne-Marie Jensen, I interviewed her. So she's on our podcast, on the Conscious Fertility Podcast. She gave me the idea because she had one Giga. Now she has two. And she has one that's made for self-serve. So people can book online. They have to have an initial, then they book online and they just come in and lie on the Giga for 23 minutes after her hours because she's using the Giga for her with patients. So she's hands-on, just like I use the Giga and I'm doing acupuncture at the same time. The Giga's over the acupuncture points. She has it off hours and her clinic set up that you can punch in the code and then as long as you put yourself in the system, can use the Giga laser off hours when she's not using it. So in our clinic, we have it set up that way too, that people can do self-serve Giga if it's not being used in the clinic for themselves. I will say, because we only have one and there's multiple practitioners in our clinic, it's often used because people are combining it with the acupuncture treatments to get, more bang for your time and money. So
that's the one Giga that you have, but what other systems do you use?
I've tested and played a lot. So the Bioflex system, I've had Luminex, Paramedics. What's the one that you have? I have
Saluma.
Saluma. Saluma I use just for facial, and other probes. Like we have a lot. And if I go back to 2008. He's retired now. He's a pharmacist that was really into low-level laser therapy. And I went to meet him because he had one of the systems I wanted to buy. And I told him I was interested. He gave me a book to read, like a medical textbook on lasers. It was pretty intense. He said, read this first. So I read it, came back. He wanted to be able to have a good conversation and see how serious I was.
Yeah.
So I read it, came back with a lot of questions. But he had a setup of 2 or 3 laser systems, one that I was interested in. And then he goes, I want to show you something. And he takes me to his back office. He opens up the storage area and it's laser systems. It was crazy.
Oh, wow.
And he said, I want to tell you before you go down this journey that there is no one laser that fits all, like for all the things you're going to want to treat. And as you get knowledgeable in the laser, you're going to want different systems because this one's better for this one's better for that.
Yeah.
And they keep evolving, right? So he goes, this is not going to be a cheap habit. And I laughed at him thinking, great, fine. I bought my system thinking I'm good. And I have spent hundreds of thousands of dollars on systems because I have a lot of systems that I play with because I look at their data sheet, what can they do, and I go for it, right? Yeah. I will say my interest in the Giga is because of Anne-Marie Jensen, because she has such good retrospective clinical charting that she has done. Like she published her clinical data, that, when something is working, I'm like, great, like, you've shown it. Because most of us, when they talk about laser and for fertility, we're quoting research, but we're quoting research on somebody else's system. And so it doesn't mean just because you're doing LLT that you'll get those results. You do have to.
It's like you'd have to be apples to apples.
Yeah. So, what's the and there's time and power, right, makes a difference. And so
Hmm.
to get those total joules, that energy in there.
Hmm.
And so, let's say you want to do 4 joules, so just make it up. Some systems can do 4 joules in 8 seconds,
Hmm.
right? Because the power is at 500 milliwatts. Some systems to get the 4 joules, it may take a minute, right? They're both 4 joules.
Hmm.
We're learning that slower is better. So it's better to get 4 joules over a period of time than right away. Think of it drinking from a hose versus a
Right.
fire hydrant,
Yeah.
right? And there's a Goldilocks window. So it's, the metaphors are loose here. But too little, too fast, too in a short time is probably not so great.
Hmm.
And that's where more of the high powered lasers are like that, right?
But
They're more,
that's what it's like being in the sun. That's why morning sunlight is easier for your body to absorb. And then that I always compare that
yeah,
hose
great idea.
analogy, because if you go in the middle of the day, it's not great for your skin.
Yeah.
It's higher UV rays, and so your body's able to absorb the nutrients a lot better when it's early in the morning or later at night,
Yeah.
naturally. Yeah.
And so I give you my joke about the Christmas tree, right? Stand in front of a Christmas tree. I don't think you're going to get any benefit, even though there's a lot of red LEDs on that
Right.
tree.
Yeah.
A colleague of mine once, I used to do this. People would send me their laser, not their laser. They'd send me their data sheet, and I'd look through it and try and do the math. Just like when I looked at the Giga before I had a Giga, I looked at my systems and I looked at how much was in 23 minutes based on 36 diodes, lasers, and 144 LEDs. How much is going into the body? Don't forget, it's off the skin, not on the skin. That makes a difference because
Hmm.
there's reflection that happens. So as I say, they say, and again, science is always changing, but it's not so much how much photons are you're emitting, is how much is your body absorbing. That's the key,
Right.
right?
Right. Yeah.
Like it doesn't go well through clothes, right? So you got to have it on the skin, not
Right.
over your clothes. You'll lose a lot. Based on what I understand at this point in time, again, science can always change, but the research is you
Hmm.
got to absorb it. And so a colleague, which I don't do this anymore. I'm saying this because I don't want anybody to send me emails saying, "Look at my laser system."
Hmm.
Um, they would send me, and I'd look at one of their systems, and they bought for like $500, and they want to do laser acupuncture. And I know you kind of want that 4 to 10 joules per acupuncture point, and because it was such a low powered laser, I said you're going to have to spend about 5 minutes per acupuncture point. She's like, I don't have that kind of time. I can't
Hmm.
do that. I go, well, that's if you want to get that dosage in, that's what you're going to need to do with that laser. And she goes, well, what can I use this for? And I said, do you ever do presentations? It's an expensive PowerPoint
Yeah.
pointer.
Right.
So, and it's not regulated, the machine. So when they test them, some of them don't give off the photons they say they do because it's not
Hmm.
regulated. So you just don't know. And so clinicians, you get used to it. You see, pain and injuries and scarring is really great because you can see it change in a short period of time in your clinic. I happen to have a photon reader. So I've taken my systems and I've put them all under there, program it to give off so many photons. And I look at the reader to see if it's giving off the photons they say, right?
Hmm.
So that helps, but not everybody has one of those.
Yeah. Well, not
Yeah.
everybody gets as in depth as you do, which is great. It's great
Yeah.
for you, like for your clinic, because it's working.
Yeah. Well, you get geeky, right? I like to geek out.
Yeah.
And then the part for our listeners is what we've seen out there for pain and injuries, and what we've seen for fertility from Oshiro, the Japanese doctor, and Anne-Marie Jensen, is dosage. So time wise, it's not a one treatment and you're done. It's kind of like, that laser acupuncture study on the transfer day, that was one treatment and done. I'm surprised there was any benefit from just one treatment. Um, she did it, and most of them say 2 to 3 treatments a week is what you're looking at, and you're looking for minimum 3 cycles. Think of the 100 days of follicular genesis. So those last 100 days are really important for your eggs, your follicles to reach their peak potential, right? And so, and Nakamura said it as well, 3 to 6 months. People can go longer, but you usually see some good shift within that 3 to 6 months. So your Anne-Marie prefers 3 times a week in the follicular. So that's 6 treatments a cycle, menstrual cycle. And by the way, if you're on Lupron or you're not trying to conceive, same-sex couple, there's no chance of a pregnancy. You can do it all month long, right?
Mm-hmm.
They just
Mm-hmm.
don't want you to put
Right.
the photons over a developing embryo. So they don't want it over the sacrum or over the lower abdomen after ovulation or after transfer.
Mm-hmm.
In our practice, we see people all month long, but again, because of our training and understanding, in the luteal phase, if we know there's a chance of pregnancy, um, then we use it differently. So we're using it over certain areas of the spine for nerve innervation that goes to the ovaries.
Mm-hmm.
We're using it over the microbiome, so we're using it high up, so kind of the navel up, so we're getting to the liver and the small intestines. So getting into that microbiome impact as well. And then we continue to do the Oshiro and other things for stem cell proliferation. I didn't mention
Mm-hmm.
that, but low level laser therapy, when it's done over certain bones like the sternum or the tibia, because you got to access the bone, has been shown to increase stem cell proliferation. I mean,
Wow.
if only we could tell those stem cells to go to the ovaries,
Yeah.
but at least we're causing more of a proliferation, right? So that's what I would recommend. If you're looking for it, you probably want to do it at least twice a week. The first couple of cycles, ideal is probably 3 times a week from what we've seen. And then you can cut it back because you do build up accumulation of photons. Like it kind of has an accumulative effect.
Mm-hmm.
So you kind of want to get that momentum going. And then as the body starts to be more efficient, think about it, as the cells are healing, inflammation is dropping, nutrition's improving, the mitochondria's balance, your blood flow's improved. It makes sense that you don't need as much because your body's functioning, right? It's kind
Right.
of doing its own thing. And eventually you get to take it away, the
Mm-hmm.
laser or everything you're doing, because your body is now has that innate healing ability primed up, right? And so that's kind of what we recommend. And for my patients and people around the world, because they like to chat, I sometimes will recommend certain home systems I like, because some people can't get to a clinic like yours or a clinic
Mm-hmm.
like mine. So there's a couple of systems that I did look at that I like, and then I teach them how to use it, how I would use it for these home systems. I have one of these home systems in my home because my family uses it for their aches and pains. Because
Okay.
so it's
Which
not just for
systems are
fertility, right?
those?
Yeah, it's kind of like everybody should have one of these in their medicine cabinet, a good laser system for cuts and bruises and tears and aches and pains.
Comes
It's
in handy.
wonderful, right?
Which systems do you recommend at home?
Yeah, well, I like the BioFlex system.
Mm-hmm.
Again, I put it on my reader, so it's
Mm-hmm.
giving. They have a home system,
Mm-hmm.
so it's giving. I could read the photons coming off of it,
Mm-hmm.
and they have a couple of programs. So I looked at the programs to see kind of what frequency they've set it at,
Mm-hmm.
and it's a nice little pad that fits nicely over the lower abdomen and the sacrum, and they can even put it around the carotid and the vagus nerve. So,
Mm-hmm.
so I teach them how to use that. Paramedics sends people probes. I thought they're lasers that they're more like for professional use,
Mm-hmm.
but they seem to they do. I'm not seeing. I know they do because I've had the public contacts me saying I have this paramedic probe. How can I use it for fertility? And so they'll set up a consult, and I will, we'll sit there and we'll go over it and show them where to put it and how
Oh,
long,
amazing.
etc. So those are the two that I've looked at and kind of spent some time with it. People would contact me and say, can you review this system? Because I bought the system. Can you show me how to use it at home? Um, I stopped just because I don't have the time to do
Mm-hmm.
that, to learn every system. It takes time to go through it. I have to contact a lot of the manufacturers, and a lot of them don't share their actual power and all the things that they say you can do. It's not sitting in front of my face on the website. It's a big dig. And then unfortunately, a lot of times when I looked into it, I didn't like to be the bearer of bad news, but I was like, this is like a Christmas tree in my mind. Like, I don't think
Mm-hmm.
this is going to do anything,
Yeah.
even though they spent $3,000 on it. So I don't want to be, they shoot the messenger sometimes. I don't want to be the bearer of bad news. So I tend not to do that at this point in time. Look at everybody's systems, really, because of it's just time. I want to have a health balance myself, right? So I can't say yes to everything. However, I do consult people, and I share with the two systems that I've looked at. I've done enough of that for other people that here's what I would do if I was at home
Yeah,
with
that's
that
great.
system.
It's good to know that people have that option in
Yeah.
case they don't really have an acupuncturist that has the, high quality system. And this has been great, Lauren. This is great information. I've learned a lot too myself, and it's really fascinating. You should do a seminar on this. Or have you
I
done a course
have
on this?
I have in process one for us, the profession,
Yeah.
and one for the public. So
Fantastic.
I said this ages ago, so I'm not even going to put a date on it, but I do have a window open where I started to go through it with some images and just sharing
Hmm.
why, the ideas, and then for my colleagues to kind of walk them through what you want to target and what kind of joules or time you want. Because some places, like the carotid, is all about time,
Hmm.
right? Stellate ganglia is very important joules, how much energy you put there.
Hmm.
So I'll explain that to our colleagues.
Yeah.
So then they can look at their system and say, okay, to get 25 joules in this area, I need to do it this long,
I would love to
or
take a course like
that
that.
kind of stuff. So that's my plan, because that's what
Yeah.
I did. Like, I have multiple systems,
Right.
and I kept on playing with the math um, to do this, right. And we go on site in Vancouver to the Olive Fertility Clinic. They're one of the largest in Canada. They happen to be in Vancouver, and we use both acupuncture and laser on transfer day, and we go on site.
Amazing.
Quick note, if I may, because I
Hmm.
forgot to mention this, they did a chart review with us of 2 years of data where we looked at genetically screened embryos, so the PGTAs.
Hmm.
And they did this because they wanted to see if what we were doing with the acupuncture and laser was helping with uterine receptivity,
Hmm.
and they wanted to rule out embryo issue. So that's why they wanted to look at genetically screened embryos
Okay.
versus
Got it.
just non-screened, right? Because
Yeah.
maybe it's not implanted because of embryo issue.
Right.
And our group, over that 2 years of data, those that had the acupuncture right before and after on-site at Olive with the laser acupuncture, we had a higher pregnancy rate and a lower miscarriage rate. And
Wow.
then we looked at, again, it wasn't a study, it was a chart review, everybody.
Hmm. Right.
Um, then we went and looked at those patients, and the ones that did a series of treatments leading up to transfer. So they did acupuncture and or acupuncture and laser,
Hmm.
or a series of treatments, a minimum of 7 before the transfer, and then plus that treatment we do on transfer day,
Hmm.
they had a much higher pregnancy rate and lower miscarriage rate. The point is, dosage matters. So if you are doing an IVF and you have somebody in your area, my recommendation is you're going in for a series of treatments. So if you're doing a frozen embryo transfer, um, at least start around your estrace, and do that 2 to 3 times a week leading up to the transfer and on transfer day, if they can go on site. And if you're doing a retrieval, you want to do at least 100 days, right?
Hmm.
And
Right.
if you have PCOS, if you have endometriosis, if you're in your 40s or repeated IVF implantations don't work, or miscarriages, then you may need even more time. So
Right.
don't hesitate. I do a lot of education. I still get people contacting me just for transfer day or a week out from transfer.
Hmm.
And we treat what, we start because
Right.
we've seen it helps just on transfer day. However, we know that if we have a series of treatments for months
Yeah.
before a transfer or a retrieval, we suspect we'll get better results because of that soil that we get to support.
Amazing. This is such great information, Lauren. And for people, I know you've been on here before, but if they haven't heard your previous podcast, how can people find you?
Yeah, best thing is to go to acubalance.ca, spelled with one C. It has links to our Instagram. We have so many blogs on low-level laser therapy for fertility. So there are a lot if you go into the blog section. So that'd be the best way. And then the Conscious Fertility Podcast, to subscribe. We pretty much release once a week an episode, and a lot of it's on consciousness. That's why we had you on there.
Hmm. Yeah.
and and sometimes it's just straight fertility with like a reproductive endocrinologist as well. So I say follow me on the Conscious Fertility Podcast,
Mhm.
and then check out acubalance.ca with one C, and they can grab our free fertility diet. It's on the homepage that we wrote, and they can look at our blogs that we have on low-level laser therapy.
Awesome. Phenomenal. Well, thank you so much, Lauren, for coming on today. This was amazing information. I know a lot of people are going to get benefits from listening to this, because I think, you hear these things, you hear about them, but you don't really understand the mechanism, how it works, what it is, and what the difference is really with what you buy on Amazon versus other brands. So this is really, really tremendous information. So thank you so much.
Thank you, Michelle.